Hi there. I wanted to go in a little bit more in-depth detail about the jaw and jaw pain and factors that are related to it. So firstly, a little bit of anatomy. Jaw pain, stiffness and clicking. When we talk about the jaw, we're talking about this little joint here, so the temporomandibular joint. So this joint here is designed to hinge, to open the mouth, but there is a little bit of forward moving. And that's controlled by all the muscles that surround the jaw, but also a little bit of cartilage, much like the cartilage that's in your knee, that provides stability and as well as the mobility of that movement when we open the jaw. Sometimes it's that cartilage or even the muscles that provide that clicking noise when you open your mouth at a certain point. So factors that influence jaw pain and stiffness, first and foremost, does tend to be stress or our levels of mood. So whenever we're in a particularly stressful time in our life, that can be through relationships, that can be through work, that can be through physical stress. We're doing too much in the gym. This can just build up tension up into the jaw. This can also be related to headaches, especially as we don't have the spine just here, but the top spinal segments move in relation to the jaw. So what I mean by that is, if you've ever been on a first aid course, one of the things you do before doing CPR is you move their chin back. So if the person's lying on the back and or you get them to move in the back and you tilt the head back, their mouth just naturally opens. And that's a nice demonstration of how neck movement can influence your jaw movement. So what we like to do in clinic, typically speaking, is we like to mobilize the neck through joint manipulation, a few clicking, massage the neck, get everything moving a little bit better. Sometimes I like to use acupuncture. There's lots of really big, thick muscles up and around here, and they're really amenable to acupuncture as a treatment. However, if you're not a fan of needles, we can use thumbs, we can use pressure points and stretches. So I'm going to show you a couple of stretches here, and I'd like to see how you get on with them. So first and foremost is we do a little bit of self-assessment, so self-diagnosis. So typically speaking, what we want to do is to get ourselves in front of the mirror and just open our mouth. So when we're opening the mouth, we're seeing a couple of things. We're seeing, one, how far we can open it, and two, if it goes into one direction or the other. Actually, three, and where you feel the pain where do you feel the pain when you open your mouth? So if I was to give an example now, so I'm looking in the mirror here, and I open in my mouth, and it comes over to this side, and I get a little bit of a click on this side, then that means this side's restricted because it's not allowing that jaw to fully open, and therefore it's being pulled towards the side that's not fully opening. So if we get a little skull here, and let's say this side's restricted, I haven't got enough hands, so I'm going to put my head next to it. If the jaw opens and it goes towards that side, can we see how, this is probably not the best example, so we can see how that opens nicely, that goes the other way, sorry, opens nicely, but then the other side doesn't open as nicely, and therefore the jaw will kind of pull towards that side. So we can use this information to bring the body in towards more neutral. So if it brings over to the right, we're going to take two fingers, press them along the jawline, thumb up onto the other side. What we're going to do is we're going to pull the jaw towards the opposite side to where the jaw was moving in towards. So, for example, if it's going that way, we're going to pull it that way. The process of what we're going to do here is we're going to do a push, relax, stretch. So when we push, we're pushing in towards the fingers, but the jaw's not moving, it's staying in its own position. So this is called an isometric contraction. We're going to hold that for 5. We're only doing this about 10-15% of our maximum force. So we only need to be gentle. It's not more powerful, better. We're going to hold that for 5 seconds, and then we're going to relax, and we're going to stretch the jaw towards the opposite side. So we'll do it in real time. We'll do it twice this time. So gonna let the mouth open a little bit. Pull, push. And relax. Pull more. And push. And pull more. And then gently release off. So you may find it is a little bit sore when you're moving it. A little bit of soreness is okay, but we don't want it to be painful. So if it's painful because you're pulling too hard, pull a little bit less. Or if it's painful because you're pushing too hard, push a little bit less. So we want to do that about 3 times, and then we reassess. Is the jaw opening wider? Is it moving less to that side? Or is it clicking a little bit better? If it doesn't, we go again. You can go 2 or 3 times. We don't want to overdo it, especially that first time, because you want to see how your body responds to that stretch. A lot of mistakes are made when we force our body to do something that it's not quite ready to do. So go easy first, and then progress a little bit more. The second stretch I like to do is more on the bottom section of the jaw. So all these muscles that connect to your throat, your hyoid bone, and down up into the traps. Maybe not as far as the traps. We're going to do a technique called inhibition. So inhibition is essentially where you're going to put pressure into that muscle, but not just a gentle pressure so that you feel the pressure, but not so that it's very sore. So we're going to start by 2 thumbs, and we're going to rest our elbows onto the knees, and that provides a nice counter force. So you're not having to just push up here, you can just relax your head onto your thumbs. So we're going to start right up in the middle here. So where I'm pointing there is essentially this part of the bottom of the jaw. So we're going to put 2 thumbs there, and we're going to then relax the head onto the thumbs. Might be a little bit tender to begin with. We should get used to it pretty quick. And what we're going to do here is same as before. We're going to do a contract, relax. So the way that we contract these muscles is by pushing the tongue into the roof of the mouth. So thumbs there, relax for 5, and then to push up. And when you relax, the thumb should go in a little bit further. So you can do the same point a couple of times, or you can move a little bit wider, find another tense point, and then same again, relax into it, and then push. And relax. And the key is to find a couple of these points all along here. So you start off in these 2 points, and then gradually get a little bit further each time. Afterwards, you may feel like you need to swallow or take a drink of water. Feel free to do that. I'd only do that once, maybe twice a day, just to see how your body responds to the movements. General rule of thumb is that the longer you've had something, the longer that it's going to take to get better. So go easy to start off with, push a little bit further each time. See how your body responds. If that doesn't quite work for you, book in an appointment with us. We can check out, see what's going on, and see what other influencing factors are affecting your jaw, and if there's any ways that we can do to help. Any questions, let me know. Cheers. Bye.